coverage that Congress gets and what the rest of America gets will be even greater than it is now, unquote. So why is there any gap at all? Republican Congressman John Fleming wants his fellow lawmakers to guarantee that they'll sign up for the public health option if they're going to vote for it for all of us. He joins us now. Congressman, thank you very much. It's a question a lot of people have been asking. Eric brought it up just a few seconds ago. So is that the case? Will the lawmakers, in fact, do this? I know you're trying to get them to sign that guarantee. What's the response been so far?
Well, the response has been mixed, and thank you for having me on this afternoon. The House Resolution 615, which I'm advancing, it simply says that if you vote for the public option, you're willing to sign up for it to be a good example for those that, quite frankly, you're providing this for. We had 69 Republicans in the House sign up for it, including our leader and leadership on down. So far, after reaching out to every single Democrat, I've not had one to sign up. However, we've had over 300,000 Americans sign our petition on fleming.house.gov in support for this litmus test that if Congress votes for the public option, for a single-payer option, then they, by golly, should be willing to sign up for it.
You know, it's an interesting little concept you got there, and I wonder about applying it to the rest of the bills. I mean, it's any time they put something through, they should have to suffer the actual consequences and not be exempt. Talk us through, though, as you're looking at the plan itself, what are the biggest issues you have with the plan itself, and what are these congressmen trying to avoid having to actually suffer through with by signing up with the public option?
Well, remember that Einstein said that if you do the same thing over and over again, expecting a different result, that's the definition of insanity. Well, look at Medicaid. Even the Democrat governors say that Medicaid is unsustainable. States are just stretched thin with that in their budgets. Medicare is set to run out of money within 10 years. And so what our president and the liberals in Congress are asking us to do is to take these failed government-run models and expand them even larger. Why is it that Medicare
but Congressman, I guess
so
the question
far
is, can you give us the solution, not what they're proposing, but what do you have to counter the at present options and ideas that are out there?
Okay, great question. I'm an original co-sponsor of H.R. 3400, which does not have a single-payer option. It is budget neutral. It does provide for coverage even though people have pre-existing illnesses. It's portability, individual deductibility. So it has all the things that we need to provide coverage and the available coverage for those who want it but have difficulty getting it. But at the same time, it doesn't cover illegal aliens. It doesn't have a public or government-run bureaucratic health care system. It does not have taxpayer-funded abortions, and certainly it doesn't do anything to encourage the advancement of end of life.
Sir, I don't like your plan. I don't like your idea. You're simply saying, hey, Congress, if you'll sign up for it, then we're on board. Are there any other Republicans who are interested in making that deal? It seems like a small price to pay for a Democratic congressman or senator to get this thing pushed through.
Well, it's more than that. This is a simple resolution. In each of the forms and through each of the committees in the House and in the Senate, we've attempted to actually have amendments in there that said, quite frankly, that Congress would be folded into it as well rather than having our private insurance and having a waiver or carve-out for years to come. And it's essentially failed in each example. So both on the resolution side and on the amendment side, it's failed.
But Congressman, doesn't that, I mean, that's just contrary to what I guess most Republicans would want is a free market system and choice. So now you're going to force lawmakers. I mean, I'm saying I think it's a good idea because if they really think it's a good option, but you're taking away that choice again because they can obviously afford better health insurance.
Or supplemental insurance.
Yeah, whereas a public option are for people who can afford health insurance, who don't have health insurance. So, you know, now you're making it a political issue instead of saying, hey, the public option is for people who don't have a job, who don't have private insurance. Now you're muddying the waters with this little gimmick.
Well, I don't think it muddies the water at all. It's a litmus test. If it's supposed to be as good as what Congress gets, then why is
They can afford something better. private health insurance will be better. So why are they going to take that? Come on.
Well, again, you may be confusing the financing and the actual running of it. I have no problem with government paying part or all of premiums for people who need that. But where I differ and where my colleagues on the Republican side differ is we don't think the government should be running these health plans. We don't think bureaucrats should step between the doctor and his patient. That's a sacred relationship. In the current bill in H.R. 3200, the Democrat form, there are 53 new bureaucracies. And this thing is going to cost over $1 trillion. Is that something that you think will be good for our future?
Absolutely not. No.
Congressman John Fleming, thank you so much for joining us.
Great. Thank you for having me.
On tap, guys, Westchester County, New York is ground zero of a government plan to expand housing for minorities.